Let's see if it works. Okay. My name is Jackie Kessler, and the paper I researched was titled Effects of Exercise Training on Adiposity, Insulin, and Sensitivity and Plasma Hormone and Lipid Concentrations in Overweight or Obese Insulin-Resistant Horses. This article is based on the hypothesis that exercise training in overweight or obese insulin-resistant horses mitigates risk factors for metabolic disease and laminitis. It also hypothesizes that high-intensity exercise is more effective at altering these risk factors, and that these alterations will be present up to 2 weeks after the cessation of training. This study used 12 Arabians fed mixed alfalfa and grass hay. There were also control horses that were either overweight with no insulin resistance or normal weight with insulin resistance. Horses in the exercise group were exercised for 4 weeks at low intensity, followed by 4 weeks at higher intensity, and then underwent 2 weeks of detraining. They measured adiposity, FSIGTT, which is frequently sampled intravenous glucose tolerance test, and deuterium oxide solutions. Overall, 4 weeks of low-intensity exercise training was associated with a 2% reduction in body weight and a 21% reduction in fat mass. 4 weeks of higher intensity exercise reduced body weight by 4% and fat mass by 34%. There were, however, no changes in subcutaneous fat thickness, and additionally, metabolic changes resulting from exercise training were not observed. Insulin sensitivity remained higher than pre-exercise values 5 days after the last exercise session when there was a decrease in body weight with exercise in lean horses, but returned to previous values 9 days after exercise. Insulin sensitivity increased after 7 weeks of training when the body weight remained constant. In obese horses, insulin sensitivity improved after 6 weeks of training and remained higher after 4 weeks of detraining. Similar changes were observed in the control group. In conclusion, 8 weeks of low to moderate intensity exercise modestly decreased adiposity without concurrent changes in glucose and insulin dynamics or basal metabolic blood variables. The results suggested that moderate exercise training without concurrent dietary restriction did not mitigate insulin resistance in the presence of overweight or obese body condition. Here we have a graph, and it was created to show the insulin and glucose levels of both the control, which are the white circles on the graph, and experiment horses in the black circles. Stage 1 is before exercise, seen both here and here. And then stage 2 is after low intensity exercise, here and here. Stage 3 is after high intensity exercise, here and here. And then stage 4 is after detraining, which is here and here. And you can see the control horses, which are white again, and black, or the experiment horses, which are the black circles, are similar, but they still have their differences. Overall, in this article, I did understand the main point, though maybe not all the little details. This article would go along with the endocrine and immune systems to exercise and training section of the 313 class. The most surprising part about this paper was that the control group had similar changes as did the test groups, and the most confusing part would be the little details described in the results. Basically, the statistics of it all obviously are a little bit confusing. I think it does have practical applications, though the applications are probably limited because the article is specific about what type of subjects you would observe these changes on. I thank you for listening to this presentation. Have a nice day.